Welcome in everybody. Today I'm going to do a short video on addressing our knee alignment while we exercise and also how that can affect the ankles. So it's a common thing that I see, especially in women, but not always. We have issues sometimes when we exercise with our knees either caving in or caving out during exercise, so the obvious movements like squats and lunges, but just about anything. It can even happen while we're walking without us really realising it. So if you get any kind of knee pain or aching after exercise or during exercise, even if it's just as simple as walking, the issue could be within the alignment, so how you're lining up your knee over your ankle. So what we're going to have a look at is just a couple of really light moves that we can do to start focusing our mind on that alignment and to see how much we can correct that and save the joints and save future injury and wear and tear on those joints as we go along in life. So one of the first ones I want to do is what's called just a basic knee drive. So we're just going to stand with our feet hip width, and what we're focusing on in all of these moves obviously is the alignment of the knee over the toes. So you want to start with your toes and your feet directly straight ahead, not pointing out or inwards. And we're just going to drive the knees forward, just in a gentle motion. It's not a squat or anything. And just having a look down as we go and seeing where our knees track as far as the line of our toes are. So are your knees coming, are they coming in? Are they coming out? Is there one doing something different to the other? So just driving the knees over. Once we learn what it feels like to have them correct and to have them driving in a nice straight line directly over our feet, we can start to learn when it's wrong and we can correct that ourselves. So, I mean, this can be something that you've been doing for so many years and it's going to feel normal to be out of alignment. So it's about relearning that movement. So we're just driving the knee forward. Now once you're comfortable that you've got your knee coming directly over the toe, you can start to straighten this line of the body out. So rather than having your bottom tucked out the back, keeping a straight line from the shoulders to the knees, so that as you drive forward, your shoulders are heading back towards the wall. And this is something you can do. It's just a gentle mobilizer just to get the knees into the correct alignment and to help them learn where they should be tracking as opposed to where they may be tracking, especially if you're getting pain during exercise. Okay, now the next one we're going to do is, I'm just going to call it a lateral tap because some of the more formal exercise industry descriptions don't mean a lot to most people. So what we're going to do is basically another knee drive, but as we do it we're going to tap out to the side. Start off by tapping out towards the back a little bit as well, not directly out at the side. So again, we're looking at that knee staying over the toe and not caving to the right or to the left. So we're going to tap, there we go, having a look, is the knee over the toe and back, and then the other one and back. Now you'll often find one side is going to be a lot harder than the other, and that's going to show you if you have a weak spot on one side. Okay, so looking down, focusing, that knee needs to be tracking in a straight line over the line of the toe. Make sure that when you're stepping back in, you're not stepping in with your toe in or out, because it is your guide for whether the knee is staying straight. Okay. Now the next one we're going to do is very similar, but we're going to tap out to the front. So out to the front, and back, out to the front, and back. Same thing. These are nice light moves, but they're teaching us to keep that knee tracking in the right, on the right line, and what it feels like to keep it correct. Now you're probably going to find that one or the other is going to happen where you feel like you're having to hold that knee out or you feel like you're having to hold that knee in. That tells you whether or not you're naturally going in or out. Whichever it is, just stay focused, keep the movement small if you need to, until you're able to really get control of that knee. Okay, now when we have issues with our knee alignment, it very often translates down into our ankles as well. So what I want to do as well now is just a basic calf lift, and we're going to have a look at whether or not our ankles are doing this a similar thing. As we calf lift, are our ankles caving in or caving out? So lifting up, having a look down while we go. So this can happen where the cave in comes or the cave out. So have a look. Probably didn't wear the perfect shoes. I'm wearing my hiking boots today. It's very cold here. Okay. Have a look and control it. Whichever one you're doing, focus your mind on it and correct that movement as best you can. Now the next one we're going to do is a hip swim, which is a mobiliser, and it's predominantly used for opening the hips. But what it also does is it causes supination and pronation in the foot. So where the foot is on the ground, and as we swing the hip around, the foot is going to do this, which it has to. Now that is really good for improving our ankle stability and strength in a very safe way. So normally you would do this with a wall. So if you have a wall in front of you, put your hands shoulder height at the wall, pick the knee directly up in front, swing out to the side, keeping that foot below the knee. So you're not swinging the knee out with the foot still in here. Okay, foot below the knee, out and across, out and across. And you can do that 30 seconds one side, then we're going to bring the other one up, out and across. So what's happening as we do this is the foot we're standing on is supinating and pronating, doing a gentle roll like that in a controlled, safe way, because we have our hands on a wall, and that's very good for improving that stability and strength in the ankle. So they're just a few things you can do to look at, to address, and to identify if any knee pain or ankle pain that you have during exercise is as a result of the alignment that you've got in your knees and ankles. So have a try of those, practice them. If you find them difficult at all, then it's a sign that you definitely need them. If you identify that you either have an internal or external rotation at the knee, these are something you want to keep working on. You absolutely can use your mind to retrain that movement and start to be able to move in a better and more aligned way and avoid future injury and wear and tear on the joint, and also relieve some of the pain that you may be getting while you're exercising. So I hope this helps, and stay tuned. We'll do another video in the next couple of weeks, and if you like this, please like the video and subscribe to the channel and share with your friends. So thanks for coming.